Hi, my name is Badur Jubanian, and I'm the head of experimentation at the UNDP Accelerator Lab in Lebanon. And today, I'll be sharing with you the work that the lab has been carrying out since September 2020 that we've entitled Experimenting with Digital Tools to Engage, Collect, and Share Information in Times of COVID. And this work was in collaboration with the country's Risk Communication and Community Engagement Task Force, or the RCC Task Force, that's led by UNICEF and WHO. With this video, we're also experimenting with a different format of working out loud and sharing our work with our colleagues, with our network, and with our partners. So we would really love to hear your thoughts about it after you've listened to it or after you've watched it. So this was a really complex study, to say the least, and I'll be sharing two different levels of learnings with you today that are really interconnected, but they're also somewhat autonomous. And throughout the presentation, I'll do my best to keep track of these two different threads. The project that I'm going to talk about has two phases, and for the purposes of this presentation, I'll be laying out the details of the first phase in section one, so in setting the stage. But most of my time will be dedicated to speaking about phase two of this work, and those are section 2, 3, and 4. So the goals of the first phase of this work were to first understand how people were accessing and making sense of information related to COVID-19, what this information landscape looked like, and how this information landscape informed people's behaviors. So we designed our research to generate both statistical and qualitative findings, and the methodology that we used consisted of a desk review, phone surveys that were nationally representative, and key informant interviews that were also carried out in September. These tools were developed in response to the challenges that were presented to us by conducting research during a pandemic, when I'm sure most of you know, fieldwork and data collection were limited or they were constrained. Just to clarify, when I refer to digital tools in the title, it's not the tools that we used in this specific phase. The ones I'm referring to will come in sections 3 and 4. I'll highlight here some of the major findings from this first phase. The lack of trust in the Lebanese government is one of the main factors that shapes the perceptions and behaviors of survey participants. These perceptions and practices around COVID-19 and its information landscape are not influenced only by health considerations, and COVID-19 seems to be strongly linked to political and economic considerations that respondents believe have a direct impact on their daily lives. Our research also showed major differences in the results across different governorates of Lebanon and across different age groups, and that a one-size-fits-all approach will not work for any sort of behavioral intervention in Lebanon. So people's perceptions of and behaviors in response to COVID-19 were overdetermined or are overdetermined. They result from the economic situation to start with, the region and the context in which they live, and their perceptions and trust in the government. These factors are intimately tied up in the information landscape of Lebanon, and this informs people's perceptions, which in turn informs their behaviors. You can see the detailed results of this phase of the research in an infographic and in a blog post that we produced. I will share a link to them at the end of the deck. We had also compiled the data from this phase on a Power BI dashboard, and that link will also I'll include the link at the end as well. So this first phase was really a generative phase for us, and it helped us identify the patterns, and most importantly, it really helped us, it gave us insight, the insight we needed to determine our next steps in phase 2. So first, we realized that we needed a lot more input to continue this line of research because it's an ongoing pandemic and it is transforming rapidly, and especially from October and onwards in Lebanon. Therefore, we decided to experiment with a self-administered online survey to capture more data or significantly more data. And second, we wanted to experiment with a chatbot as a source of COVID-19 information because our initial findings showed that people wanted a more interactive and a more engaging channel to use for COVID-19 information. So here I'm going to describe the two experiments very briefly, and then I'll go in depth in the next section. So the two experiments, like I said, were the survey, which was on SurveyMonkey, and a chatbot. And just to kind of quickly explain what a chatbot is, it's some sort of it's a software application, or an application that is designed to simulate the way a human would behave during a chat or during a conversation. And this is something that we built in-house, and we now have the expertise internally. So the chatbot was there to help users calculate the number of people that they come in contact with on a weekly basis, and the number of people they might contract the virus from. And both of these experiments were pushed through Facebook ads on UNDP Lebanon's Facebook page. So Facebook ad management became another kind of expertise that we now have internally. So I'll walk you a little bit through the survey and the chatbot and kind of the reasoning behind them. For the survey, the rationale was that we needed to expand the sample first. There was a need to validate the findings from Survey 1 and the key informant interviews, and we wanted to experiment with digital formats, especially given the limitations of fieldwork. The guiding questions of the survey were: what are the different sources of information used by Lebanese residents to receive and share information? What is the overall assessment of shared information? Like, what do people think about it? Do they think it's good? Do they think it's bad? Is it a lot? Is it not enough? And how does this available information shape the knowledge, the perceptions, and behaviors of Lebanese towards COVID-19? So as an accelerator lab, we work with hypotheses, and these hypotheses are set so we can validate them or invalidate them through the different experiments that we run. So I'll share with you some of the experiments that we had for the survey here. First and foremost, the hypothesis or the assumption was that online surveys are an efficient tool to collect information. People are interested in expressing their opinions about COVID-19. People are willing to take a 20-minute survey. It was that long. The survey in 2 languages, in English and Arabic, will be inclusive. And if we launch it online, we will collect enough responses to validate the findings from Survey 1. If we expand the sample size to 1,000, that was our goal, then we'll have more representative data. And if we make the data and findings from the first survey or from the first phase accessible, then people would be more incentivized to engage and share with others. Now I want to walk you through the designed user journey. And what I mean by that is to walk you through all the steps that we expected people to follow in accessing, in filling out, and in concluding the online survey. And this is a big part of our approach as an accelerator lab, right? To imagine the user's experience even before we launch something or before we launch a product, as a way of anticipating some of the friction points or the pain points or the hurdles that they might face. So the user first sees a Facebook ad. They click on the ad and it opens up the SurveyMonkey page. They start the survey, they finish the survey, and then they go to a thank you page. Moving on to the chatbot, the rationale behind the chatbot was that the findings of the Survey 1 show that the survey respondents needed facts to sensitize them to the severity of COVID-19. And they recommended the use of interactive tools, and particularly tools that had some sort of an engagement component. The guiding questions here were: how do we intervene in the information landscape using digital tools familiar to the communities that we work with? And how might we use a common channel of information such as WhatsApp to sensitize people to COVID-19 and its impact? The hypotheses that we were trying to test here were that if we use a channel familiar to users, then they are more likely to engage, and this will increase our reach. If we make access to COVID-19 information easily accessible and more interactive, using a gamified approach, for example, then people will more likely engage with it. If people solicit COVID-19 related information themselves, as opposed to kind of instructed or forced information, then they are more likely to believe and consider it. If people realize how close the virus is, or if we use some sort of a shock factor, then they will be more incentivized to take preventive measures to manage COVID-19. If people speak to a non-human interlocutor or a robot, a chatbot, then they will feel more comfortable speaking about their COVID behaviors. And finally, if the information is communicated on a personal level and not through national campaigns, so if the information is customized, then people will more likely engage and listen. Again, the user journey or the design user journey of the chatbot was similar to the survey. The user sees the Facebook ad. or one of the Facebook ads. They click on it and they open the WhatsApp. They start the chat and then they finish the chat. And both of these flows or journeys were kind of linked. So users who finished the survey, they had the chance to engage with the chatbot, and users who engaged with the chatbot and they finished, they also had the chance to go in and fill out the survey. And we were trying to kind of maximize the traffic here from both of these flows. So in the next two sections, I will be going over the major insights that we learned from the research. And I've categorized these in two ways. First, in this section, I'll be talking about what we learned from the data that we collected through the digital tools about COVID-19 information, behaviors, and perception. So about the actual data, or like the topic. And in the next section, in section 4, I'll be talking about what we learned from the tools themselves. So what did we learn from using them? More on the methods and tools side. With regards to the learnings from the data, we have an incredible amount of information, and I really can't go over it all today or in the next, I don't know how many hours. So what I'm going to do is I'll just share some of the most interesting finds. And at the end, I will also share the links to the infographics, to the dashboard for you to peruse on your own time. And these infographics and dashboard have maybe 10 or 20 times the amount of information or the data that I'm going to share with you today or right now. So before I continue, I want to quickly kind of share a note on Facebook ads. As I said, we use Facebook ads to disseminate both of these tools, so the chatbot and the survey. And we used a broad category targeting on Facebook ads to reach a large audience. So our goal was to have kind of the largest or the biggest reach possible. And the Facebook advertising algorithm is programmed in a way that it serves ads where it gets the most interest in order to optimize the ad results. And when I say to optimize the ad results, or when I say the most interest, I mean the number of clicks they get and kind of the conversion rates it gets. This means that the data that we've collected here is inherently skewed, since it is not necessarily representative of the country, but rather an indication of the reply rate or the click rate based on certain variables. And these could be based on geography, based on device placement, based on the different type, the type of device that the users are using, and the different demographics. And I'm saying this because this survey sample should not be considered as nationally representative, and its demographic characteristics such as age, gender, geographic location, education, and employment status are not necessarily reflective of the national statistics. And just to illustrate this more, the current sample that we have represents women more than men, so 68% and 32% for males. And we have more young groups between the ages of 23 and 29, and more highly educated people with bachelor's and master's degrees. Also to mention that this was a self-administered survey as opposed to the first one in the first phase, which was really handpicked. The survey respondents were handpicked to represent the country and its demographics. So from now on, from kind of this part will be similar to kind of a PowerPoint karaoke or a Google slide karaoke, so bear with me here. The top sources of information people rely on to receive information include COVID-19 specific websites such as WHO and the CDC, Ministry of Public Health website, Facebook, television, and news websites. And similar to the survey, to the results of survey 1, Instagram and Twitter rank low in the hierarchy of information sources. We've also found that respondents with higher levels of education are more likely to use COVID-19 specific websites, and those with a lower level of education are more likely to use Facebook. Area-specific social media groups are a significant information channel. So 33% of our respondents indicated that they are aware of area-specific Facebook groups, and 59% of those are members of one or two of these groups. 22% of our respondents indicated that they are aware of area-specific WhatsApp groups, and 61% of those are members of at least one or two of them. And the major types of information that circulate in these groups are COVID news from the area, COVID news from neighboring areas, national news about COVID, and community member news. There was no correlation between trustworthiness and frequency of use, which we found interesting. And with the exception of COVID-19 specific websites and the Ministry of Public Health website, the most used sources of information are not necessarily considered the most trustworthy. And as expected and consistent with the results of Survey 1. The most trustworthy people are the medical doctors, either in person or on TV, and the Minister of Public Health. And it's important to mention here that when people talk about Minister of Public Health and government, they see these two things. They see these two as two separate things. So they have trust in Minister of Public Health, but they do not have trust in the government or the ministry, right? And lastly, the most used local TV channels are LBC, MTV, and Al Jadid. Those are all local channels here. Public figures and influencers are not likely to make a difference, and more than 50% of respondents are not influenced neither negatively nor positively by recommendations from celebrities, or politicians, or religious figures, or community members to wear masks. 54%, however, stated that they are more likely to wear a mask if recommended or enforced by the Ministry of Public Health. Social media campaigns will influence only 47% of respondents to wear a mask. The accessibility of information channels also mattered. People appreciate channels that are easily accessible and are interested in seeing data and numbers in context. People are interested in using interactive tools, particularly those with an engagement component, as we saw earlier, and people are more responsive to information communicated on a personal level. Also, the ability to ask questions without being judged proved to be important. The majority of our respondents were satisfied with the quality of information on COVID-19, but they were divided on the quantity. 62% of our respondents reported information to be of moderate quality, and 10% reported information to be of high quality. 41% believed that the quantity of information is moderate, and 40% believed it's low. And 63% of them believe that the consistency is moderate, and 28% believe the consistency is low. 70% of the respondents believe that the amount of misinformation around COVID-19 is excessive, and this is linked to three top factors: the inconsistency of information, lack of scientific information, and lack of fact-checking. And the majority of respondents, they don't share COVID-19 information on social media. Trust in information is determined by personal judgment, not fact-checking, and most of our respondents said that they rely on their common sense or their self-constructed judgment of the information source or channel. So it depends on who is relaying the information to our respondents. Fact-checking is not common, and the top reasons for not fact-checking are limited capacity, lack of interest, and the limited knowledge. And interestingly, respondents between ages of 23 and 29 were more likely to state lack of interest as a reason for not fact-checking, which kind of showed this kind of I don't care behavior. When people do fact-check, however, they use sources that they know are not trustworthy. We found this to be very interesting as well. So WhatsApp and Facebook are the sources that are most frequently used to fact-check, even though when we talked about trustworthiness, WhatsApp and Facebook ranked low. And this incongruence presents an opportunity for future research. And the assumptions that we could have here is that WhatsApp and Facebook might be the only ones of these channels that allow for users to share and to share a link or information, or to discuss with somebody else kind of the content. So they could maybe copy and paste the links to somebody to ask for, a friend or a family member if this information is correct or if they think it's correct. Most of our respondents do not fully understand the government's COVID-19 strategy. Only 22% fully understand it. In age group 60 plus, the participants in Nabatiyya and participants with elementary education show the lowest level of understanding. 75% of the respondents do not trust the country's politicians to deal with the pandemic. And there could be correlation between people's lack of trust in the government and their inability to understand its strategy, but we haven't proven this yet. So the assumption is that if somebody doesn't trust the institution or the government, then they won't bother themselves, or they won't even be interested in trying to understand the strategy that they are presenting. Overall, there's a very low level of trust in the municipality, the municipal police, and the Union of Municipalities to manage the pandemic and enforce measures. And I will leave this here for a couple of seconds so you can see it. This was consistent also with the data from our qualitative research. The economic situation significantly shapes perceptions of and the behaviors towards COVID-19. and people have to choose between protecting themselves from getting COVID-19 and generating income from their families for their families. And this is something that we saw in the past couple of weeks in Tripoli. As many interviewees also expressed, people prefer to die from COVID-19 rather than letting their families die from hunger. The ability to follow protective measures depends on one's economic status. So 42% of our respondents cannot afford to stay home, with no major difference across areas, gender, and employment status. 32% of them cannot afford to purchase a mask, and 16% cannot afford to purchase disinfectants. As I mentioned, this raw data is visualized in an infographic, and it's probably 10 or 20 times more than what I presented here. We've also put it on a dashboard that you can access using the link at the end of this deck. And this dashboard is interactive, so you can filter the results based on age, based on area, gender, employment status, and an education level. And at the end of this deck, like I said, I will make sure to include the link. So one of the goals of this project was not only to collect information about the pandemic and about what people think about COVID and what's going on, but also to reflect on the tools that we use to collect data. And this is what I meant with engaging people using digital tools. So in this section, I'll be zooming out and I'll try to explain the thinking behind the experiments and some of our discoveries about launching a survey of this scale on SurveyMonkey and trying out a new interactive channel like a chatbot. And my hope here is that not only these discoveries will inform future initiatives within the UNDP Lebanon Country Office, but that some of the, or our partners obviously, but that some of the methodologies that we've used will have relevance to our work and the work of our partners, and not necessarily COVID-specific methodologies. So I'm going to go back to this design journey map, journey kind of flow for both the survey and the chatbot. And I'm going to start with the survey. So the first step that the user, kind of the first touch point with the user is the Facebook ads. And just like the survey hypotheses, we had hypotheses specifically for the survey ads, for the Facebook ads, and I'll share a few of them here. If we use Facebook ads, then we will reach our target of 1,000 responses. If we share data from our first survey, then people would be interested in sharing their comments and responding to the survey online. If we use behaviorally informed messaging in our captions that are linked with the ads, then more people would be engaged. If we use different types of visuals, then we'll know which ones perform better for the future and which ones are more attractive to our users and our audience. And finally, if we create ads both in English and Arabic, then our campaign would be more inclusive. So based on this, we developed 6 captions, 6 visuals, and 2 languages for a total of 72 ads that look pretty much like this. The one on the left is just a simulation, and the images on the right are the different images in both English and Arabic that we've developed. And all of these images, they were paired up with 6 different messages that had data from the first phase of our research project. So all of the numbers that we've used are actual information or actual data that is not that is linked to our phase 1. And we injected kind of BI messaging into them. And the 6 kind of behaviors that we looked at were overconfidence that says everyone believes they are right and everyone believes they are above average. The confirmation bias that says people analyze and search for information in ways that support their own biases, their own ideas, their own beliefs. The herding behavior that means people tend to do what others are doing. The identifiable victim effect that assumes one identifiable individual triggers deeper emotions and sympathy than a large group of anonymous individuals. The now bias that assumes people put on an unrealistically high value on the here and now and an unrealistically low value on the future. And this is really significant of Lebanon in our context here. And the last behavior that we were testing was loss aversion. And this assumes people react to losses more strongly than gains, and they try to prevent losses more than they try to make gains. So 806,000 people saw our Facebook ads. And out of the 806,000, 41,200 actually clicked on the ad to open the survey. And thousands of them, they engaged by liking, commenting, and sharing the ads. And I'm including here a couple of screenshots of one of the most famous or kind of the most clicked on ads, you can see those had more than 200 comments on each of the ads. So Facebook really taught us a great deal, and I'll go over a few of the most interesting insights here. The most prominent one is that Arabic ads performed much better. Ads with photographs as opposed to illustrations or kind of graphics performed much better as well. Ads with photographs and quotations together performed much better than those with percentage data. Ads with just the title of the survey performed the worst, and ads with the caption that said 46% of Lebanese agree that it's easy to stay home and not socialize was the most effective compared to other captions. The sample is not nationally representative, and this is in relation to what I mentioned earlier about Facebook targeting, how we used a broad targeting category. And finally, the BI messaging that we used was successful in triggering people's responses and comments. So these four messages these four captions are the ones that were the most popular one, and the four behaviors were overconfidence, confirmation bias, herding, and denial bias. So out of the 41,210, you can see about 73 or 74% of them were in response or in reaction to the Arabic ads. And out of those, 19,692 actually started the survey, and the division between English and Arabic is still consistent here. Out of the 19,692, 4,231 of them actually went on to finish the entire survey. So this was a 20-minute long survey, so this is a good number. But the numbers that we see here, they don't really tell the whole story. And we were monitoring the number of survey responses closely, and we immediately realized that there was a huge drop-off between the starters of the survey and the finishers of the survey. So to give you an example, on the first couple of days, out of 2,266 starters, only 484 finished the survey. And I know that you might think this is a good number given the length of the survey, like the 20-minute survey, but we really wanted to optimize this, and we wanted to optimize it more. And in order to do that, we needed to understand what was happening between starting and ending and finishing the survey. So we monitored this survey live. And when I say live, we were really looking at each question and each response as they were coming in. And we were doing this to try to identify if people were dropping off at a specific stage or at a specific after a specific question. And we actually were able to do that. We found out that the biggest drop-off point is right between sections 2 and 3, so right in the middle of the survey. And only 53% of our of the respondents that were in section 2 were continuing on to section 3. So we decided that we wanted to test with a BI message right at the start of section 3 to see if it will have any sort of impact on the numbers. And we introduced the following sentence. Great, you're among the 27% who have made it this far in the survey. The following sections are about information sources, behaviors, and trust in institutions, and we're excited to read your thoughts. And this message was kind of tapping on two behaviors. The first one was relative ranking, that assumes that our performance tends to improve if we are told that our peers are doing better than us, so the 27%. And the goal gradient behavior, that assumes that people will work harder to achieve a goal as the goal gets closer. And this additional sentence really increased the number of respondents who went on to the next section by 6.7%. And even though we can't really know how many of these went on to complete the survey, we know that overall the completion rate was increased by 1.75%. So the 4,321 who finished the survey, they landed on a thank you page that had 4 calls to action. The first one was to share the survey, and this button got 306 clicks. And the strategy or the thinking we had here was kind of this foot in the door thinking. So if we had users who were with us for 20 to 25 minutes, sharing the survey would just take maybe another few seconds. So we were trying to test if that would work. The second call to action was to chat with Fahman, and Fahman was the name of our chatbot. It means he who understands. And this button got 923 clicks. And the last one was the option the last two actually, was the option to view the results of the survey by perusing the infographic from phase 1. And this was in 2 languages. And if they wanted, they could check out the raw data on the interactive dashboard that I showed you earlier. And you can see that we had 189 clicks on the interactive dashboard, and on average we had 29 seconds spent on this page. And 29 seconds might be low, it might seem low, but we also have to think about users who came into the dashboard and they saw, these different graphs and a lot of information. They might have felt overwhelmed and closed the window right away, so maybe in a matter of 4 to 5 seconds. So we can assume that if we had people who closed it in that kind of in that short of a span of time, we might have had people who stayed on maybe for a minute or two to really look at the data and maybe draft their own narratives or kind of try to desegregate them based on factors that matters to them and their own projects. So to do some sort of a quick hypothesis check, I'm not going to read them all. The ones highlighted in green are the ones that were validated. The ones that are not highlighted in green, they were cause for further reflection. But our learnings did not only stop at hypothesis validation. We also had some new learnings, and I'm going to go over these really quickly. At every step of our journey, Arabic significantly outperformed English. And the responses that we got in Arabic suggest that many of the respondents were not necessarily Lebanese. They might have been Palestinian and Syrian. And that we should have included a question about nationality in our survey so we could better desegregate or filter out the answers. And the preference of Arabic invites us to think about our target audience. Are we studying Lebanese perceptions, or are we studying the perceptions of residents in Lebanon? And if it's the second one, then we should really include other languages in the future. And other languages don't only include Arabic and English. Obviously, we can look into French, into Amharic, into Tagalog, or any of the kind of common languages that migrant communities in Lebanon speak. And finally, the dashboard that we tried to put there, kind of to share the information or the data, seemed to be also validated. So going back to this journey, we're going to see this slide a lot. I'm going to go now to the chatbot design journey. Again, the first step was to see the Facebook ad, and the hypotheses here specific to the Facebook ad were similar to the Facebook survey or the SurveyMonkey. A few of the different ones were that if we highlight robot in the messaging, then people would understand they are not directly speaking to a human. The rest is pretty much the same. It's about visuals and the captions and understanding which ones are more attractive and more they could perform better for future comms campaigns. So here we designed 3 captions, 3 visuals, and 2 languages for a total of 18 ads that looked like this. And just like the survey ads, we obviously coupled those with 3 messages, and each of the messages was kind of tapping into a specific behavior, and these were different than the ones that we tested with the survey. There was the gamification effect that assumes people like to play games, and they will go kind of great lengths to playing games, even if all they get is some sort of a number at the end. And the number here that I'm talking to is the number of people that they come in contact with and they might contract the buyers from. So there's no kind of material gain or material reward. The second one that we were testing was the personalization effect that assumes that people are more likely to engage with and respond to information which is tailored to us. And this is something that came up in our first phase of research. And the last one is the salience that assumes our attention is drawn to what is new and what seems to be relevant. So what is new is kind of this chatbot tool, and what is relevant here is COVID-19. So these ads were seen by 1.2 million or around 1.3 million individual unique users. And out of those, 86,000 actually clicked on it, and they went on to engage with the chatbot on WhatsApp. And hundreds of them, they engaged by liking, commenting, and sharing the ads, similarly to the survey. So again, what did we learn here? Some of them are in line with the survey learnings. Arabic still performs much better. Photographs are doing much better than other visuals, and ads that had visuals that say that had kind of a calculation call to action that say, talk to Fahmin, talk to the chatbot to calculate the number of people that you come in contact with, performed much better than others. And ads in Arabic with the caption, answer a few quick questions, performed better than Fahmin or the chatbot is here to help. And finally, the BI messaging, again here, was successful in triggering people's responses and comments. Again here, most of the, around 70% of the clicks were in reaction to the Arabic ads. And this was consistent, like as you saw with the survey. And out of the 86,000, 1,600 actually engaged or kind of started discussions with the chatbot. And although there's a really huge gap here, I mean, between 86,000 and 1,600, it's a significant gap. We didn't really have any evidence to explain why or to kind of validate why, but we were able to think about or to kind of come up with some assumptions or theories for such an extreme drop-off. And I'm going to share them with you here. The first one is that the term for chatbot in Arabic, robot al-dardasha, likely did not resonate with users. So this is something that we learned really quickly. Already the idea of a chatbot is not very common. So we went on and we said, why don't we translate this to Arabic, which made it a bit more, even more kind of unfamiliar or kind of strange. And we think this might have deterred people from engaging with it. Another one was that the link within Facebook ad sent users to WhatsApp along with a warning message that looks like this if you're on mobile. And this might have also deterred further engagement. If people are not kind of used to going between two apps using kind of deep links or hyperlinks, then they might have clicked cancel and then stopped the interaction there. If users were looking at this ad on a computer or on web, they needed to have WhatsApp web open in order for them to interact with the robot. And if they didn't have it at all, then that interaction would have stopped right there. The deep link that we had set up when users opened WhatsApp, the deep link had some sort of a message that said hi that showed up as soon as people opened WhatsApp. And this kind of maybe feature might have been a bit too advanced. And it did not really help us with people or with users that are not chatbot literate. So they saw hi, and if they accidentally sent the message and they received the reply back, a lot of messages that came in said, how did you get my number? Who are you? And why are you talking to me? So they didn't really understand how the chatbot interaction works. And out of the 1,622 people that actually finished the interaction with the chatbot, a few of them actually went on to finish the survey. So I'm going to share with you here kind of a quick video. We can consider this as a break in the presentation. It's a bit obviously fast forwarded, but it'll be a good break for you and for me. Okay. So I hope that was a good break. And just like the survey, we were monitoring these messages as they come in, and we were making sure that we address any flow errors in order to optimize user experience. And if you're wondering what that flow or the back end looked like, or the interface that allowed us to monitor these closely looked like, here's a quick snippet. And during the first 2 days, we noticed several error messages that were coming in through the back end. And naturally, we wanted to understand the reasons behind them and what triggered them. And because we built this on Twilio ourselves, so without hiring a consultant or a company, and I can't really iterate this enough, this was really kind of a blessing in disguise. We had to do it ourselves, which meant that we had the option of going in and making changes on the spot, as opposed to running these by either a company or a consultant, which would take a longer time. So we were able to understand users' behaviors and try to fix, and we were able to fix the flow on the spot to optimize their experience. So in other words, this kind of setup allowed us to live iterate. So I'll share with you here some of the challenges or some of the things that we were iterating or we were fixing or we were addressing as we went along. First of all, we taught the bot the most frequent typos, both in English and Arabic. I haven't included all of them here, but these are some of the ones that you could expect. We removed the use of quotation marks because people were retyping them. So if you can look at if you see on the right, we asked users to type restart at any moment to go back to the first question. And because we put restart in quotation marks, people were retyping it to get kind of together with the quotation marks, which was putting the chatbot in error mode because it wasn't recognizing what that specific command meant. So we removed it altogether, and this fixed our problem. Another thing that we did was that we removed the additional delays, which we had added during the first round of user testing. So what happened is when we did it with the first kind of the beta testing of the chatbot, a lot of our users said that you need to add some delays after somebody sends a message because no human is fast enough to type a full-on paragraph and send it back in a matter of a second or two, which made perfect sense to us. So we added these delays. However, this did not work to our advantage at the end. Users who got used to the chatbot were not really patient with responses, did not really wait for responses. So ones who understood how the chatbot works, after they sent a message and they did not receive a reply in 2 or 3 seconds, they were sending another one thinking that the chatbot is not working. So we had to go in and remove those delays so that the chatbot doesn't get 3 or 4 consecutive messages and not understand which one it should respond to. We also specified the need to use English numerals because Twilio, the platform, doesn't recognize Arabic numerals or actually Indian numerals. So the question that, for example, the question that asks how many people do you come in contact with on a daily basis outside of your household, users had to reply with a number, with a Latin or an English number, so that the algorithm in the back end could take that number and put it into an equation and spit out a total number. So we had to tell people that you have to use Latin numbers and give them the example of 0 to 9 as opposed to 0 to 9 in Arabic or Indian numerals. And finally, we clarified the inability of the bot or the robot to receive calls and or voice notes. And this is something that we can't say it was a surprise. So in Lebanon, and I'm guessing in the region, WhatsApp is used as a substitute for phone calls. So people use it for voice notes, for WhatsApp calls, and not so much as to text or to type. So we got a lot of people who were sending us voice notes, who were trying to call us, and the bot obviously doesn't understand or doesn't recognize these functions, so it was going into error mode and not responding to the users the way they wanted to be responded to. So these are some of the examples or a glimpse of the messages that we received about calls and voice notes, and you can see how people are frustrated. And for the ones of you who don't speak Arabic, I'll kind of translate some of them. The first one says, please answer or please pick up, send me voice notes. Hello, do you hear me? I need you to send me voice notes. Please send me voice notes. Yeah, the rest is just send me voice notes. Hello, hello, hello. So people were really, you can see that people were frustrated. So apart from these apart from the live iteration, we also received a lot of unexpected messages. And I categorized these into 3 main clusters. The first one was questions on health information. So questions that we did not expect to hear or to read were things like, what masks do I use? How does COVID-19 spread? Or where do I go get tested? What are the most recent numbers? How contagious and dangerous is COVID-19? And et cetera. Excuse me. The second cluster or category of information was request for assistance. So we had people talk to us and ask us questions such as, where do I apply for assistance, cash assistance? I need work, I need assistance. My house was damaged due to the explosion. How do I get assistance? And I can't afford to stay home. And users shared these important concerns or questions probably because they saw that the ads were posted by UNDP Lebanon, so on UNDP Lebanon's Facebook page, but also because the chatbot was linked to UNDP's Facebook page. So on Twilio, we need to go through this verification process because we're using a business profile and not just a regular WhatsApp number. And it had to be linked to our UNDP Lebanon page. So people would see this automatically, UNDP Lebanon. And if they click on the business details, they also see the link to UNDP Lebanon's website. So they might have made that link as well. So UNDP assistance, cash assistance, and not necessarily UNDP, but UN, UN in general. So in Lebanon, for the ones of you who are not familiar, UNHCR and UNICEF, they have cash assistance programs for refugees in the country. The last or like random category or like random questions or unrelated questions were things such as how do I steal Wi-Fi passwords, or how do I recover deleted pictures, and finally I want to lose weight fast. So these are some of the ones that I just they were my favorite and I wanted to highlight them here. There were plenty others. So as I said, the ones who finished the chat, they had a call to action, and this call to action took them to the survey, and they gave them the opportunity to fill out the survey. And in fact, we had an additional 181 completed surveys that did not come from Facebook ads, and we can assume that these 181 came either from the chatbot or from the shares that people had from the shares that people had done earlier on in the after they finished the filling out the survey, the SurveyMonkey survey. Again, to do a quick hypothesis check, I'm not going to go through them quickly. The green ones are the ones that we've validated, and there are two here that were behavioral changes. So we were not able to validate these now at this moment, and for the future, we have to make sure that we put in more specific measurement or like metrics to be able to see if people's behaviors is actually changing in relation to COVID-19, if they're taking it more seriously, if they're taking preventive measures more seriously, etc. So these two we were not able to validate them with our current experiment. And as I said, or as we saw earlier with the Facebook, with the survey chat, with the survey ads, we had also additional learnings that we found, and I'm going to read them out loud here. The majority of the Arabic messages that we received were non-Lebanese dialects. They were in Syrian or Palestinian dialects, and if you're able to read the Arabic ones, you would be able to see that some of them are not really Lebanese. And this really gives us a sense of our audience and demographic. And also, there seems to be a need for an open communication channel for people to ask COVID-related questions. And there's a value in having a non-human interlocutor. So we believe that because the chatbot was non-human, people felt comfortable enough to ask questions such as, what kind of masks do I use, or where do I go get tested? And this was done in late December, right? So the pandemic was in Lebanon for about 9 months by now, and I don't think people would have felt comfortable, or I wouldn't feel comfortable going and asking somebody, what are the symptoms of COVID-19, or how can I get tested? And having this inanimate kind of non-human kind of object or channel answer questions or be accessible, prove that people might have kind of basic questions about information on COVID-19 that they want to ask, and they might not have the option to ask outside of this channel. There was also a need for a system that refers people to the UN and its resources and its services. We saw this with the different messages or questions about assistance. And finally, there's a need for more languages in order to communicate with communities in Lebanon. And I didn't include these in the examples, but we had a couple of messages that came in Amharic and a couple of messages that came in Tagalog. So if we really want our experiments and our communications to be inclusive, we need to make sure that we include languages that are specific to migrant communities in Lebanon. So some others that I can quickly think about are Armenian, French, and I mentioned Tagalog and Amharic. So moving forward, I want to just quickly recap on the learnings, and I'm not going to go through these in detail. I'll just give you a minute to look at these over. They're just some of the highlights. They should all sound familiar by now. Okay. So our possible next steps, and these are things that we're currently still working on. We're trying to find different colleagues to work on them, or trying to identify kind of streams that are existing so we can hop on them or we can kind of add on to them. I'm going to go over them really quickly and I'll finish the presentation here. So the first one was going into a study on perceptions and behaviors around the COVID-19 vaccine, because this is kind of the what people are speaking about now, and this is kind of right around the corner. Analyzing the data on reasons for trusting and sharing news. So we have a lot of qualitative data on this, but we really haven't had the chance to analyze them manually, because they are kind of open-ended questions, and we have over 6,000 responses on them. So we need to really dedicate some time to do that. And this kind of the analysis here would help us better frame or kind of strategize on communication efforts in the future. Building capacity and promoting tools for fact-checking, and this is something that's already happening within the UNDP country office with the fact checkers and the Count to 10 campaign. And we've also, together with the UNDP, together with Accelerator Lab Global, they've set up a partnership with TED, the Healthy Internet Project, and we're one of the countries in Lebanon that is trying to kind of test this. And we think there's a lot of kind of opportunities for us to link the TED HIP tool with misinformation around COVID-19 in Lebanon. We could also work on creating tools that are more accessible and engaging. And I can give a couple of examples here. It could be maybe the dashboard, make it a bit more accessible to not only people who are familiar with dashboards, but also the general public, and channels or tools such as the chatbot to add more content to it, to make it a bit more sustainable. Another thing that we could do is optimize the most used sources of information or information channels. And here I could give the example of the Ministry of Public Health website that seems to be the most trusted one. So we could go in and look at the UX of the website to see if it's really answering people's needs and if there's any room for improvement or optimization. So kind of a product development there. We could replicate the tools that we deployed, not necessarily in COVID context or COVID-related topics, but also outside of those, because the tools, or like the Facebook ads, the chatbot, the survey, could be tools that we could really socialize across the country office in different on different projects and portfolios. We will continue to work closely with the RCCE on future comm strategies. So these comm strategies could be on a national level, on a national scale, or on a regional scale. And finally, we will continue to make this data accessible. And this is one of the things that we really hold kind of close to heart, because all of the data that we've collected is not really owned by us, and it should not be owned by only the UN or the UNDP. We want to make sure that this data is accessible to everybody or anybody who can make use of it. And this is exactly why we wanted to put these dashboards up for people to kind of go in and filter out based on whatever their project is or whatever their focus is, their sector is, because we need to make sure that this is the data is socialized, but also sharing data is socialized among us and partners and our colleagues. Okay, and I would say that's a wrap. Here are the links I promised. And I think it's already been exactly an hour. We plan to do more of these videos and maybe even try with podcasts in the future. But these would obviously not be in lieu of blog posts. We would do these kind of in parallel. So please do share any thoughts, feedbacks, or any sort of do's and don'ts that you've come across that could really help us polish this kind of format for the future. Thank you very much, and see you soon.